Hello, I'm Dr. Jerry Mixon from Longevity Medical Clinic, and today we're going to talk about the aging process. When I started this clinic way back in 1998, we were cutting edge. Well, we still are. But in those days, cutting edge was basically bioidentical hormone replacement. Most people think of bioidentical hormone replacement as giving testosterone to men and estrogens to women, but it was more than that. What we had realized was that the aging process involved a global decline in essentially all of the hormones that we require to be strong, fast, lean, smart, sexy, and happy. When those hormones were declining, we slowed down. We started getting fat. We started getting weak. Our bones were thinning out. Our brain was slowing down. We were getting memory losses and problems of that sort. The key, we thought, to aging was to put all of those hormones back to a more youthful level. And it's true. It worked to a great extent. When we found out that we could raise your pregnenolone, your testosterone, your dihydroepiandrosterone, your progesterone, your estradiol, and your thyroid hormone, along with your growth hormone, up to the youthful levels that you used to enjoy, men and women both became more self-confident. They got their drive, their ambition back, their sexuality improved. They shifted their metabolism away from fat and towards muscle. Their bones started getting thick again and strong. That was our initial approach to aging. Well, in the last 26 years, we have discovered a lot more than just hormone adjustments to improve your aging. We've now gone from that one thing to 12 different potent, important factors that will alter how you age and how fast you go downhill, or perhaps how well we can take you back up that hill and let you be running, jumping, leaping, cavorting, and having a good time for, a few decades longer than we would usually or used to have thought was appropriate for you. I want you to take a look at this, what causes aging, a destructive cycle. You see, it looks almost like a pinwheel, a very colorful pinwheel. And in that pinwheel, there are 12 different factors that we now know are critical components to the aging process. And the more of those components we address, the better job we do of making you stronger, faster, leaner, smarter, sexier, happier, but also lowering your risk of cancer, lowering your risk of dementia, lowering your risk of heart disease, making your muscles to be stronger, your pains and aches and stiffness to fade away, and generally to feel and function as well as you did 20, 30, maybe even 40 years ago. Today, I'm going to be doing videos on all 12 of those items. But first, I want you to take a look at the global picture, because this is what we need to address to help you age the way you should. Now, you notice I have not used the phrase anti-aging. And that's because making you younger would involve warping space and time, and you've lived how many hours you've lived. We don't do anti-aging, at least from that standpoint. But we can help your brain and your body function as well as it did decades ago. And we can keep you functioning far better than normal for many, many decades. The reality is, normal's great when you're 18 years old, but by 40, normal starts to have some minor drawbacks, and by 50, it's a pain. And by 60, 70, 80, normal stinks, because really bad stuff is normally happening to you as you age. What we're going to do is we're going to look first in the next video at hormone decline. Then we're going to take a look at your stem cell senescence. Yes, stem cells become senile and become less and less functional. Then we're going to look at your mitochondrial dysfunctions. The mitochondria are those little organelles within your cells that generate the energy for life. And as they go bad, you go bad. We're going to look at what stress does to you. Not just the occasional stress, but the chronic stresses of daily living. We're going to look at what high energy consumption and rapid turnover of your tissues does to you. It turns out that the faster and better you function, the faster you tend to age, but there's things we can do about that. There is the dysfunctional gut microbiome. I'm sure this is something you've all heard about right now. The bowel bacteria and virus mixtures in our gut actually change as we get older, and they're not the same way as they used to be, and there's things we can do about that. Then there is DNA damage, methylation. Our genetic material's tough, but the world is tougher. And over time, our genetic code is degraded and altered by radiation, toxins, infections, and just bad luck, so that we do worse and worse job of growing new tissue over time. There is senescent cell increase, the increase in the number of senescent cells. Cells are supposed to turn over. When they get worn out, they're supposed to die and be replaced by new cells, but some cells don't do that. They actually become what we all laughingly refer to in our clinic as the zombie cells, because these are cells that have exceeded their lifespan but refuse to die. At the same time they refuse to die and be replaced, they also refuse to do their job, and in fact, they become destructive. They start interfering with your healthy cells to be able to do their job. And then there's the toxin overloads. Now, we all get exposed to toxins, but at some critical point, the toxic load in our body builds up high enough that we cannot cope with it very well anymore, and we start getting sick. There is overnutrition. That's a nice way of saying getting fat. More calories in versus more calories out for a long period of time. But we're going to talk about fat and how it is a killer, how it causes diabetes, dementia, heart attacks, strokes, osteoporosis, degenerative joint disease, all sorts of horrible things. And then we're going to address inflammaging, which is just a chronic low-grade inflammatory milieu within your cells that sets you up for all sorts of diseases, including early death and dementia. Then finally, immune dysfunction. Our immune system, as we age, is going downhill, and it's going downhill rather dramatically, but for the first time in history, we now have ways that we firmly believe can help you to redevelop the immune response of a younger, healthier, more robust person. And in doing so, we think we can lower your risk of cancer, heart disease, even more important, infections. There's a reason that old folks are the ones who die of COVID or die of the flu or get a lot of cancer. And a lot of that is due to the suppression of our immune system with age. And we're going to talk about how we think we can probably boost your immune system and give you an extra 20 or perhaps 30 years of a robust immune response. So I know that's a lot. Sit tight, listen carefully. There's going to be 12 more videos for you to watch, and we're going to cover each and every one of those 12 things. So if you want to know what you can really do about the aging process, if you want to be stronger, faster, leaner, smarter, sexier, healthier, if you want to avoid cancer, you want to boost your immune response, if you want to not slide downhill at a predetermined and horrible rate, come to Longevity Medical Clinic and let us do our thing. We're going to help you be the best you can be for as long as you can be. See you in the next video.